assistants. And what I found interesting about hair restoration is the physician does his part of the work, but the surgical assistant dissects and places grafts, and if she or he doesn't do her job correctly, everything that physician did in the first phase of hair transplantation can be ruined by poor graft dissection and graft placement. When someone starts hair transplantation practice, usually they don't have enough patients to provide enough practice for assistants. So what I did is I divided hair transplant training program into pre-patient and a patient program training. Usually the training is done on live tissue. If someone is starting a practice, they don't have enough live tissue, so I developed this pre-patient training so someone can develop dexterity and awareness of hair transplantation before even starting on a live tissue. So the challenge was not enough patients, not enough tissue, being nervous. Someone starting to dissect tissue on a patient is nervous, and it takes long time for someone to develop skills if someone starting practice has occasional patient and occasional opportunities for practice. So there will be a phase 2 training, and Marian Parsley will teach us or teach you about phase 2 training. And then I also will address today the learning objectives for phase 1 training and outline the process itself. So the most trainings are performed, as I said, on live patient. And what happens when a new person starts learning how to dissect or place grafts, they are very nervous not to damage the tissue or to hurt the patient. And also, they don't want to ask questions because they don't want to sound ignorant in front of the patient. So the pre-patient training on a dummy will alleviate these concerns. The uniqueness about assisting in hair transplantation comes from manual dexterity. So the person has to have a good hand and eye coordination and physical stamina to sit for hours and dissect grafts. It requires physical stamina. But also there has to be a mental aptitude for tedious work. Not everybody is capable of sitting for hours and dissecting grafts. So this pre-patient training will allow someone to discover whether they are good for it or not. And during this training, we're going to introduce critical thinking. We're going to teach what to do, what not to do, so the person starts thinking along the lines of providing a quality. So the phase 1 training in my practice or my teaching takes about 2 to 3 weeks. And the person will learn about the procedure, learn about tasks, and it will be a practicing cutting and placing on a dummy. And then a phase 2 takes about 6 to 12 months, and where assistant is now participating in a surgery, working on a live tissue, and now working with instruments, setting up for surgery, sterilizing. The phase 1 training has 2 steps, which is first one is on a dummy, and I will later demonstrate how to cut and how to practice cutting. And this first step is to provide the opportunity for a person who is learning dissection and placement to develop proper hand movement, holding instruments correctly, and understand body position. And the second step of this training will be done on using photos of the live tissue. So the person before even touching a live tissue will know what to look for. We'll talk about follicular units, about slivers. So there will be certain concepts already introduced in a pre-patient training. So the cutting and placing on the dummy, and I'll demonstrate this later. So the objective would be for someone to hold the blade in a forceps. They imagine that this is a tissue, cut slivers, and everybody will have an opportunity to practice this so you can develop the hand movement and practice making even slivers in the foam, and then dissect the sliver into even pieces. So the idea behind is for someone to be able to guide the blade, hold the forceps firm but gently, because if someone pushes too hard on the foam, the foam will show. And also to be able to develop a certain size. Every graft has to have a specific size to fit in a specific site. So dissecting foam, slivers into halves and halves into quarters, will allow someone to start practicing this tedious work. And then the same thing, I take styrofoam head, I put a swim cap on it because you can't insert anything into styrofoam. So I pad my styrofoam head with Play-Doh, and then I put swim cap on the top. So when I make sites, there's a given layer underneath, and then I can take foam pieces that I made kind of grafts, and the person can insert that into the styrofoam head. So the idea behind it is for someone to learn how to hold a tiny piece, how to hold the forceps and insert it in the site. So developing hand movement in awareness of the body position and body position vis-a-vis the patient. So these two images just demonstrate I attach the styrofoam head to a patient's chair, and then the assistant, so if I imagine this is my patient's head in a chair, so I will train one assistant to position herself from one side, then show working from the back, and then coming from the side. Because the hand movement will change, the forceps we'll use will change depending where we are positioning on the body. So all this is introduced without being in the presence of the patient, so the person who is trained feels comfortable to learn. I, as a trainer, feel comfortable to correct or guide the assistant without being intimidated by patient's presence. I always focus on quality, and so at every step, whatever I'm teaching, I'm always making sure that the person who is trained is aware of quality. For me, the quality is based on knowledge, that is, knowing the difference between what to do and what not to do, what is correct and what is incorrect action. If I only teach correct actions and someone does incorrect, they don't know how to correct themselves because they don't have the guidelines. So I always explain why correct is good, and then I also point out what is incorrect. And so, for example, holding forceps, they're very delicate forceps. I always explain they have to be held firm yet gentle. And the reason I'm using foam, and I'll demonstrate this later, when someone squeezes on a foam, the foam will lift, which will tell me the person cutting will crash the tissue, which is a wrong movement. So all through this training, I will kind of point out what to do and what not to do. And everyone in the room will have the opportunity tomorrow afternoon to practice cutting foam and placing, and just kind of get the feel of what it feels like to cut, and then you'll have the opportunity to do the same thing with a live tissue or a real tissue. The other thing I mentioned something earlier, I also raise the awareness of body positioning. Everyone working on a tedious work gets cramped because they're so concentrated that I teach while we are cutting foam to relax the shoulders. There will be long hours of cutting. The person has to start developing right body positioning during cutting. The same thing, if this is my patient's head and the assistant is putting hand in front of patient's face, I have to make trainee aware that patient is a live person, that we have to be positioned in a way that we never kind of put patient in a position that he is covered by our body. So all that is explained during this pre-patient training. During the placing, I do the same thing. I always say what is the correct, what is incorrect action. We talk about gentle handling. If the person crushes the tissue, traumatizes the tissue, and this is mentioned in the bottom as mistakes, they can be a kinky hair growing, so the hair will not grow natural. If the tissues are not hydrated properly, the result will be poor. There will be suboptimal growth. If the hair is not oriented correctly, the growth will be unnatural or grafty. So I focus, even placing the foam in a styrofoam head could be a good opportunity to introduce how to handle grafts, to remind a person to keep the tissue moist, and how to orient. So we're teaching the hair angle orientation. The second part of this training is on photographs. What I do, I take a photograph and then we play with the idea. Everybody will get a printout of the photograph, and then the assistant will draw the line through the photograph and imagine where the cut would happen. The idea is to cut one row of hairs. It's called sliver. Miriam will explain this in detail in the next presentation. This is just the introduction in a pre-patient training. The same thing, hair grows in clusters. As you can see, there are clusters in the first photograph on the left. I drew the line to show how I would separate the clusters. There will be 4 follicular units on the top. On the right side, I show that they could be isolated as single follicular units, or they can be kept together as an individual graft, and they're called defollicular units. Critical thinking is, in my opinion, very important. How can I provide a quality if I don't know what I'm looking for? So we talk about gentle manipulation. So it's a delicate work. The other thing we talk about is that the grafts have to be hydrated. They also have to look good in a certain shape. We'll discuss that more in a phase 2 training, but this is just first introduction. So the more person hears about the quality, the more quality becomes something to look for. And then poor quality graft, I always show, and I will show you now, there is grafts on the upper row that they are transected, they're not acceptable grafts, and then we make a comparison with the clean grafts. Like you can see the hair shaft is transected, and that is not acceptable graft. We also talk about graft viability. If the graft is left to dry out, it doesn't have as high chances of surviving. So on the left, far left, is a hydrated graft. It has a luster, there's a little glossy look to it, and in the middle is dried out. It's made that there's no gloss anymore, and the far right is dry and transected. So once again, for quality, I have to show what is good and what is bad for someone to know how to strive for the good. And at the end of my pre-patient training, what I do is I play a little kind of test game where I give this image with terrible grafts. And then I say, what can you do about it? And so the person will think, take a pen and design where the cut would happen, and how many grafts can we make. The first one, none, because the grafts are transected. I don't even know if I can use this pointer. Oh, I'm sorry, I can't show you. I'm sorry? Oh. Okay, good. So this one, I hope you can see the grafts hairs are transected, so they're not viable hair shafts, so I can't consider this as a good graft. The second one, I would make a cut on the side. What I'm going to do, I'll kind of go back to this one. There's an extra tissue, so we're going to dissect the tissue here. This one, I would dissect the tissue on the right, and these 2 hairs have viable hair shaft. I'll keep them that way, so I'll give you back the picture without the line. You see there's extra tissue we want to dissect from there. This one I would divide in 2. There would be 1 hair graft on one side, 2 hair graft on the other side. This one would be dissected on the right. This is questionable. I don't know what is on the other side. It doesn't look like there's a straight hair shaft that I can preserve as a viable graft. This one I will dissect the bottom portion. I'll go back to the picture. You'll see there's a little hair cut halfway to the top, and so I will dissect that out and keep this as a clean graft. Do the same thing here, dissect this and discard this, and dissect this and discard this part and discard this part. And so this is what this picture shows. So why phase 1 training? The objective was to expedite the training period. Remember, it may take much longer because someone starting practice doesn't have enough patience to practice. So practicing on the foam gives the opportunity to a person to develop hand movement, start thinking, understanding graft dissection, body position. Also we talk about procedure, techniques, quality. So there is the base of hair transplantation assisting that happens during this phase. And then someone develops stamina and skill during the practice, and the other would be to decrease stress during the learning process because the person can ask questions. I will demonstrate the foam cutting